Hi, everyone. This is Michael Lappin from the WSAVA One Health Committee. I can't tell you how excited I am today to get to learn more from my friend and colleague, Dr. Melinda Merck. As you might know, Melinda is the co-chair of the WSAVA Animal Wellness and Welfare Committee and has quite an interesting track record in veterinary medicine. She's been working with shelter medicine, practice, forensics, gosh, disaster. It's just amazing what all Melinda has been involved with. And if you haven't had a chance to read her book on veterinary forensics, the second edition of that is currently published by Wiley. It's really neat to see what Melinda does. She's consulted with lawyers, veterinarians, physicians. She basically has this just wealth of knowledge in this field. And we've been very excited to collaborate with the One Health Committee in this arena because it's truly a One Health problem, as you'll hear as we go through the 110 minutes or so today with questions at the end. So I hope that you will learn as much as I have from this great lecturer, speaker, and proponent of WSAVA. I did want to also make sure to thank the One Health sponsors for helping us put on these types of events. Currently, the Purina Institute, Zoetis, and MSD are our core sponsors for One Health. And so thanks to them for helping bring us all together today. But Melinda, I can't wait. Every time I hear you, I learn about 10 new things. And so here we go again, and looking forward to the workshop in Lisbon in about 18 months or so as well.
All right, sounds great. Thank you,
Take it away.
Okay. All right. So thank you everyone for joining. This hopefully will be informative and not only educational, but also empower you to develop plans so that your team is prepared. I want to start with, this can be a triggering lecture for several reasons. So be prepared, get your phone out with your favorite pet photo or funny photo of family members. So if you need to take a moment, that's important to do, to be self-aware of what it might be triggering for you. All right, what is interpersonal violence or domestic violence? Those terms are used interchangeably. It refers to any physical, sexual, emotional, economic, or psychological actions or threats of actions that a reasonable person in similar circumstances with similar identities would find intimidating, frightening, terrorizing, or threatening. And noted that this is from the University of North Carolina, that they include that some such behaviors may include not only threats of violence to oneself or a family member, but also they include the pet, right? And that the interpersonal violence can, in this broad range of abusive behavior, it includes a romantic or intimate partner, a spouse or partner, a family member, a cohabitant or house member, including a roommate, right? So that's, I think, a very deep definition. So I'm going to use the term domestic violence and interpersonal violence interchangeably. And there's something we refer to as the link, and this has been studied for decades, I think back to the 60s, 50s, 60s. And this refers to the link between animal cruelty and other forms of violence. And some of the findings through the studies and the surveys have found that those that commit animal cruelty are 5 times more likely to commit violent crimes. It's linked with child abuse, both physical abuse and sexual abuse, and elder abuse, and this domestic violence. There's also been a link documented from multiple studies about the link between domestic violence and the sexual abuse of animals. I believe the New Zealand study, I believe it was around 20% of the survivors reported being forced to witness, participate in the sexual abuse of the pet. Their more recent study found that when analyzing adult sex offenders, that those with a background of drowning animals or as juveniles or having sex with animals as juveniles was the greatest predictor of them becoming an adult sex offender. 41% of men arrested for domestic violence had a history of animal abuse. Another one is that they found a much higher, 11 times higher incidence of dog bites in homes with child abuse. It's so important, this link, that on this is just some of the highlights, that the FBI in the United States is now tracking it in their behavioral analysis unit in their National Database Crime Reporting Center. So that's been really good. There's been one publication and hopefully another one coming out about what they're finding. And this just highlights, this is one of the latest news stories highlighting that link.
Kent County men face years in prison, each accused of killing pets during separate incidents of domestic violence. Tonight, 13 on Your Side's John Hogan talks to domestic violence experts who say this type of abuse is a form of control. And we want to let you know some of the details of the recent cases might be disturbing.
Experts say there is a link between domestic violence and pet abuse. Abusers will exert control by threatening to kill or even killing an animal.
When an abuser threatens or actually harms a pet, it's a very effective tool of coercion.
Tara Aday works at Safe Haven Ministries, a domestic violence shelter in Grand Rapids. She says animal abuse linked to domestic violence is more common than people realize.
As a component of their abuse that they're experiencing, they'll often talk about the threats to their animals.
Kent County Prosecutor Chris Becker says it is a disturbing component of domestic violence.
And so that's a natural tendency that we see quite a bit, where somebody will go after an animal.
That's what police say happened in 2 Kent County cases that recently appeared in court. 46-year-old Joshua Morgan killed a kitten and injured a second during a domestic assault on Michigan Street Northeast. His girlfriend was beaten and threatened with a gun.
The gravity of these crimes, basically pounds on the table.
Judge Joseph Rossi sentenced Morgan to between 3 and 15 years in prison. Morgan apologized.
The shame I feel every day is like a spear right through my soul.
In a separate case, 24-year-old Brandon Price is charged with animals killing, torturing, and domestic violence. It happened in Kentwood back in December. He's accused of beating his pregnant girlfriend and throwing their puppy against a wall. The dog was euthanized. Becker says animal abuse is a form of control.
And so I'm going to take away something that you care deeply for because you're not obeying me, you're not following my commands.
85% of domestic violence shelters indicated that women coming into their facilities reported incidents of pet abuse.
Are there threats to pets or animals? Because that's a pretty good indicator.
Charisse Mitchell is CEO of the YWCA in Grand Rapids.
So if I'm abusing pets, there's not a big leap for me to be abusing my partner.
Penalties for abusing animals vary, but killing a pet as a form of domestic violence, well, that is a 10-year felony. In Grand Rapids, John Hogan, 13 on Your Side.
So that's what we're seeing is some of the laws changing and recognizing. I know Canada, I think Victoria was considering that, and around the world, they're starting to recognize that as a form of domestic violence. So the penalties, the laws are addressing that with higher penalties, recognizing the danger. Now, in domestic violence or interpersonal violence, there's some startling statistics in the United States. 1 in 3 women and 1 in 4 men will experience this in their lifetime. The World Health Organization reports 1 in 3 women will experience domestic violence or sexual violence. Worldwide, 50% of female homicides were committed by an intimate partner or family member. And a study in the United States found that similar, up to 46%. Same thing in our major cities. And then we need to consider the pandemic isolation impact. These are crimes, both domestic violence, child abuse, elder abuse, and animal abuse are crimes in isolation. They do very well in isolation. That's how they get away with it. And it may not be detected. The pandemic, we saw worldwide, everywhere, France, Italy, Spain, the UK, including the United States, the impact on the crimes, the domestic violence, and eventually we started seeing animal cruelty go on the rise, though they may not have been able to respond during the pandemic as easily. So that actually makes sense, right? Because they're isolated with their partner. We've got all sorts of stressors going on, which can escalate the anger, escalate the frustration, the economic impact that may have happened to them. I know a friend of mine who runs the Los Angeles SPCA and works with their domestic violence shelters said within, I think it was within 15 minutes or 30 minutes, their shelters were full. They've actually had to go to hotels, motels to be able to house all those that need it, because as soon as it happened, as soon as the shutdown happened, people who are living in those homes are like, oh my gosh, I'm not going to be able to get away from them. So tremendous impact that we don't really know fully yet. The other thing we know is that up to 88%, depending on the study, of pets in these domestic violence homes will be threatened, injured, or killed. Domestic violence survivors are 11 times more likely than non-victims to report pets have been physically hurt or killed. And here's the most disturbing numbers is that 45 to 65% of those in domestic violence situations will delay or not leave that home at all if they don't have a place or cannot take their pets. So that is a huge barrier from them being able to escape the violence. So when you do the math, in the United States, we have 85 million people with at least one pet. That means we've got about 28 million pets at risk. And in Canada, 16.5 million cats and dogs, that's about 5.4 million pets at risk. So it is an important issue for the veterinary community. You have to keep in mind that the most dangerous time for a victim of domestic violence is when they leave their abusive partner, right? 75% of domestic violence homicides occur upon separation. And there's a 75 increase of violence upon the victim upon separation for at least 2 years. So it continues to be a threat after they leave. Now, as veterinarians, we always want to know why, the whys behind things if we can. And so why do perpetrators abuse animals in a domestic violence situation? It's, as was mentioned in the news video, demonstrate power, to teach submission, to isolate them from a support network, by threatening the animal, express rage at something they've done, perpetuate this context of terror, which is allowing them control, prevent them from leaving. If you leave, I'm going to, kill the cat. Punish and terrorize, and certainly confirming this power wheel of the cycle of reaffirming their power over their victim. Now, they may start with animals and then move to their human partner, right? They may force or coerce them to engage in the abuse. We've seen cases like that, a lot of cases like that, systematically killing the pets. And this is something for us to look for in the veterinary setting. So it's important to look at the history of all the pets, to ask those questions about prior pets, everything in that home, because it may be under a different name. Elder abuse is a hidden problem. Only 7%, at least in the United States, are reported, but more than 35% of adult protective service workers reported their clients had advised them that their pets were injured, threatened, or killed, or denied care. That's very common. 45% of these workers reported seeing intentional animal abuse or neglect when visiting clients. And 75% of their clients expressed concern for their pets, and that concern was affecting their decision about whether or not to accept intervention or other services. Yet, less than 50% of these workers are screening for animal issues. So that's a big problem. That's a barrier, and people are working in silos. Now, the veterinarian's role. Some of us, depending on where we practice, may be what's called a mandatory reporter, where we are required to report suspected animal cruelty. Some places have the veterinarians are mandatory reporting reporters of suspected child abuse, elder abuse, or family violence. But we have, regardless of our laws, we have an ethical duty. There's the Canadian Veterinary Medical Association, their statement: it's imperative to be prepared to assess and respond to both human and animal cruelty. Once abuse and or neglect or suspected, intervention is critical to breaking the cycle of violence for these victims. Your role is to make the report to the appropriate agency, either the Humane Society or social services. It is their job to further investigate the concern. If cross-reporting is not mandated, conduct a phone consult with the proper agency and seek advice as how to proceed further. I mean, that's a tremendous, powerful statement from their National Veterinary Association. And on their website, they even have signs of child, spouse, and elder abuse. Oh dear, let me see. I may have a freeze up here. I was a little worried this was going to happen, so I'm going to switch to where I have a different PowerPoint set up. Oh, wow. Bear with me 1 minute. The fun times of Zoom and the internet. Okay. All right. Give me a minute to let that load up. All right. Okay. Now, in pets of domestic violence, there's certain indicators and management of that, suspicious indicators, and we're going to talk about management and considerations. Now, who are the animals at risk? It's dogs and cats less than 2 years of age. Younger animals tend to be more destructive, can be more aggravating, so that makes them more at risk. Older animals, if we see them as victims of abuse, we tend to think about that the animal was pre-existing in the home and then someone new came in, whether it's a new relationship, it can be a child in the family. Male dogs tend to be more at risk, and the theory is that violent offenders tend to prefer intact male dogs, so that may be a link there. Large or giant breed dogs are more at risk for sexual abuse, those tend to be. And then cats, regardless of the type of cruelty, whether it's hoarding, neglect, or physical abuse, they're more likely to die from being abused than dogs. Now, what are the suspicious indicators? The most pathognomonic feature, it's the same as it is in child abuse, is of physical abuse, is repetitive injuries or finding injuries in multiple stages of healing. A history of unexplained self-resolving symptoms or injuries, especially CNS signs. Similar injuries to other animals, these unexplained deaths or disappearances that they may tell you about or try to provide as an explanation. And when their history or whatever story they're giving you is inconsistent with the injury, your examination findings, as you ask them more questions, they change their story. They tend to have a high pet turnover. You may have a list of animals from that same home where that's only been seen once at the vet. The pets never live long. They always run away. Maybe the story. The owner's behavior can be a suspicious indicator where it's inappropriate for the situation. They can be aggressive. They can be very like they're in discomfort, embarrassed, or there may be complete apathy, indifference. Now, animals may present to you, and behavior questions should be part of your history taking, but they may present for this where they're having behavior issues that are aggressive, that changes in behavior that may be fear or anxiety based. There may be an inappropriate delay in presentation for something, and that may be because of the financial control the abuser has on them and won't allow them to go to the veterinarian. And then there's certain types of injuries and fractures, which we'll discuss. The most common cause of trauma, especially blunt force trauma that you see in practice that isn't consistent with accidental is going to be domestic violence related. Now, for domestic violence indicators, again, the client behavior, you may see injuries on the client or one of their children. They may feel, and I'm sure most of us have experienced this, where you have a client who can't make a simple decision. They seem paralyzed about making basic decisions, and that's fear of spending money, or that's that power and control that their abuser has. There's physical and emotional abuse of the animal. There's multiple types of abuse going on in these homes. It's chronic. I already mentioned they systematically can kill off the pets, but the injury patterns are different than known accidental causes. And what do they do, right? When we're looking at these patterns, what are they doing? And from different studies, the most common that a perpetrator is doing is throwing the animal against the wall, against the ground, against the floor, slamming them. And other things are kicking, striking, punching, hitting. They may neglect them. So withholding food or water, putting them outside in bad weather, abandoning them, refusing medical care, intentionally giving them drugs or alcohol, drowning or burning, suspending them by their neck, legs, or tail, and then sexual abuse, as I already mentioned. Now, so Dr. Reisman is the lead forensic veterinarian for the ASPCA's hospital in New York City, and he did his master's on this. Now, on what are these, is there a pattern of injury? And he is responsible, his group is responsible for seeing all the cruelty cases of all of the surrounding area of New York City. So looking over the retrospective study of 3 years, he found that of all the cases, they had 66 cases that were linked with interpersonal violence involving 79 animals. That comprised 8% of all the cruelty cases that they dealt with during that time. What he found was they have a higher mortality in domestic violence cases, 33% versus 10% of all other types of cruelty. He also found that they tended to be small. So cats, about half, 52% were cats, 48% were dogs less than 15 pounds with an average of around 7 pounds. So what did they do to them? 51 out of the 79 animals had blunt force trauma. 24 were thrown as a witnessed event. 19, they had blunt force trauma they found on exam. 8 were stomped, kicked, or hit. And then 18% were neglected. 13% had non-blunt force trauma. There was a variety of sharp force trauma, so stabbing, a gunshot, burning, strangling, partial drowning, and one instigating their dog to fight another dog. And only 5% of the cases was no injury found. So here's the pattern. 15 animals had multiple bone fractures. 13 of those were deceased. 13 of those were a witnessed event, and in 11 of those, the animal was thrown. So thrown against the wall, the ground, slammed something. So the fracture pattern he found is all of them had it in more than one region. It was the head, legs, ribs was the pattern. One of them had their pelvis broken. So it was skull, mandible, and teeth were the most common, but head, legs, primarily the femur, and ribs. And this is unusual in that we don't tend to see this pattern in other known causes of accidental injury. So that is the pattern based on pretty much the slamming of or throwing of animals that you need to keep in mind. So head, legs, and ribs. The most common cause of accidental injury is motor vehicle impacts, so motor vehicle accidents. And we know this, there's several studies that have been published about these kinds of injuries and what to expect, but we see this a lot, right? What do we see? It depends on where the animal's hit, any secondary impacts. It also depends where you are in the world and which side of the road you drive, because in the United States, we drive on the right side of the road. So most of the impacts are on the left side, 80% because of decreased driver reaction time is the theory. And so if you drive on the left side of the road, it's going to be on the right side of the animal. The body can be tossed in the air, rolled, run over, or dragged. So we tend to see dirt and debris in the furs. We tend to see skin abrasions and contusions. Cats put out their nails to try to stop movement or rapidly moving their paws trying to climb. So, but we can see that with motor vehicle accidents, frayed nails. But the fractures that we see, it just depends. This was a study that was published in the Journal of Forensic Science in the United States in 2016. It was a retrospective study with Tufts University and the ASPCA's hospital in New York. This did not make it to the veterinary journals. And what they found, they looked at was non-accidental injury, which is what we call animal cruelty or animal abuse. And they had 50 cases of those, and how they define that is that the people had been charged. Someone had been charged with animal abuse. And then they have 426 cases of motor vehicle accidents that they looked at. And this is the pattern. The blue arrows, skull fractures, teeth fractures, vertebral fractures, rib fractures, damage to claws, that's going to be primarily dogs, and scleral hemorrhage, those were seen in a higher incident of animal cruelty, not motor vehicle impact, not motor vehicle. So the pattern that should make you suspicious is skull fractures, teeth, vertebral, rib, claws, scleral hemorrhage. The odds ratio in favor of a motor vehicle accident is pelvic fracture, sacral, iliac luxation, abrasions, degloving, pneumothorax, pulmonary contusions. Makes sense, right? They get popped, right? It takes tremendous force to fracture the pelvis. The other thing they noted was the presence of older fractures. So remember what I said about older healing injuries. When that was found, it was 120 to 1 in favor of the animals being abused. The other thing, they looked at a frequency comparison, and this just summarized what I just told you. But one thing I want you to note that sacroiliac luxations and skin lacerations, none were noted in non-accidental injury cases, right? So remember this, when you see rib fractures, it's not very common at all in motor vehicle accidents. They also looked at the pattern of fractures, in that 92% are on one side. So in the United States, it's going to be primarily on the left. And they were located in clusters, and this makes sense. The more fixed, rigid part of the thorax is more susceptible to fracture. So the clusters were, if they were present, 1 through 4, then 4 through 7, then 7 through 10, and then last was 11 through 13, right? With cruelty cases, non-accidental injuries, 64% were one side, 36 were on both sides, and there was no location pattern, which is what you would expect. So if you see a case of fractured ribs, it's bilateral fractures of ribs in the mid to caudal rib cage, or bilateral at all, that should be a suspicious indicator. We need to look for more signs that that was a motor vehicle impact, such as those skin abrasions or dirt and debris in the fur. The other thing we're looking at is growing in veterinary medicine. It's been around for a while, and is how can we detect some hidden trauma, especially knowing that animals don't bruise visibly on the surface of their skin unless there's severe bleeding underneath. So we looked at thermal imaging using forward-looking infrared cameras, and these cameras scan whatever they're scanning. It's registering the surface temperature. It's used in law enforcement. Like I said, it's been used in veterinary medicine for a while, and now there's more and more devices available to the veterinarians. But so if you use these cameras, you want to establish a database of your normals. There's certainly online courses to take, but this is my long-haired shepherd, and that's arthritis in her right carpus. We still use Fahrenheit primarily here, so mine's set at Fahrenheit, and you can see the more yellow and white, the hotter it is. But you want to rescan the animal to see if that's a chronic or an acute inflammatory area. So I went to the emergency practice my friends owned and would just scan animals with known injury or known trauma. And this is a dog that had back surgery earlier that day, so it's really hot. This is my cat with hot ears, cold nose. This is emergency practice, cold ears, and an abscess below the right eye. Sub-Q fluid line going in, sub-Q fluids in under the skin, so it's cold. I worked with an investigator in Atlanta, Georgia, and he started using the camera and then would, as an investigator, and then would work with veterinarians to analyze it. So his camera has a little different scale. The white is hotter. This is an emaciation case, so there's actually very little fat or tissue covering bones, so it helps outline how emaciated the dog is. And then this top left dog here has a swollen testicle. Again, may not be able to appreciate that from a photo, but when you thermal scan it, you can see that. And then trauma above the eye, a white hot area. And these are really good for investigators working with veterinarians when they say the puppy fell down the stairs and broke its leg. I want to see multiple points of impact. The key issue, you got to scan pretty quickly because they heal up quickly, right? So the inflammatory response may be gone. This was a case we used at the emergency practice where a man brought his dog in. He admitted that he had kicked the dog once in the abdomen because he was ripping up the sofa when he came home, and the dog had some fluid in the abdomen, extremely painful. In talking with the prosecutor, we did a conference call right away. I said, if we thermal scan the dog and we find multiple points of impact, like you kicked the crap out of the dog, would that matter to you? And she said, absolutely. So we got the investigator over, and he did. He found one single location, which was consistent with what he said, in the abdomen. So it can be used that way. Now, those cameras can be really expensive. So they make less expensive. FLIR does. All this is available online on Amazon as well, as a standalone, but they also make, not going to be necessarily as detailed, but it may serve a function for you. Like I said, they're making veterinary versions, but there's also an attachment you can get for smartphones. It's a less expensive. Again, the detail isn't going to be as great, but this was the first generation one. They have a second generation one that's a little bit better. But you can see this is from my phone. Certainly you can do video with it. You can see the heat on the hardwood floor from where my dog had just walked. So it's a potential much more affordable option. All right. Now, sexual abuse. What are the suspicious indicators? Any type of unexplained medical issues, chronic issues, trauma involving the genitalia, the perineum, the anorectal areas. You can see bruising in that area, or you can see where they grab them or restrain them. And so there tends to be what looks like these hand grabs, and it may be in the lateral lower abdomen or the middle of the torso. You can also see it in the medial thighs, and it may appear as linear bruises, or it can be blanching in that area, also restraints. Also, we can see injuries, chronic cellulitis over the neck, over the muzzle from chronic muzzling, the ears, a flaccid tail. They tend to hold the tail and get it out of the way. One thing for vets is that when we are seeing refractory chronic vaginitis, rectal bleeding, rectal or vaginal prolapses or strictures without a medical cause, a history that would explain that, we need to stop and think, because they will bring their animal to the vet, right? Any abnormal behavior or reflexes during the exam, hyperarousal, guarding. So ideally, when you're examining these animals, you got to think DNA, right? This is not the time we want our DNA involved with our exam or evidence collection. And there's books, there's articles out about what to do. Certainly there's chapters in the different forensic textbooks. Think about getting a sexual assault nurse examiner to assist, because it's the same type of process. You're going to look at the animal head to tail. You're going to look for semen, ideally using an alternate light source like a UV light. Sometimes the Woods lamp can identify it, sometimes it doesn't. Getting full body radiographs, consider colonoscopy, vaginal exams using an otoscope or speculum. They may have used drugs on the animal, especially the chronic sexual abuse cases, sedatives, Cilio, dexdomitor. So if that's part of the investigation, we may want to consider drawing blood. to potentially run tests, blood for analysis of those drugs. This is a case, a friend of mine in British Columbia had a suspected sexual abuse case, and when he did the exam, he was able to take the photo. He's got contusions and next to the cervical area and the vaginal area, and there's a blood clot, right? Not normal. These are puppies, and you can see the anal dilation and vaginal trauma. This is a grab area that I talked about. This is another medial thigh, some kind of restraint or grabbing, and then some blanching. Here we have some more trauma to the area. Now, behavior indicators, I mentioned that are anxiety related. Part of the questions we need to ask is does the dog, is there a new person coming into the house, workmen, cleaning people, housekeepers? Is that behavior associated with someone new? Extreme fear reactions can be an indicator. Inappropriate responses to the environment, including shutdown. Extreme guarding of the body, extreme reactions to an exam. If that any of this behavior, or they're having fear, anxiety to certain stimuli, certain types of people, sounds or smells. And then of course, any behavioral indicators of pain. Now this is that same dog. This is before he's able to examine the dog. He's just trying to examine the dog. And so she's being very reactive. So they've gone ahead and precautionary, put a muzzle on her. He's done nothing. He hasn't done the vaginal exam yet, but I want you to watch what she does.
That's a good girl. Okay. It's okay. That's okay. Sorry, hon. Hey, we let you lay there. How's that? You just lay there. Good girl. Good girl. Okay. No, we're going to give you something.
So anytime he gets even near her rear, just goes near that back leg, the tail, that region. And then you saw, of course, that he later confirmed that she had been sexually assaulted. This was a case that came into my practice years ago, a behavior consult where a female owner lives alone, indoor only cat, has a boyfriend, and has this 2-year-old female spayed Persian that every time the boyfriend walks in the apartment or into the room where the cat is, the cat would freeze, scream, squat, urinate and defecate, and then run out of the room. That was the behavior consult. So that is an extreme, I'm going to die fear reaction whenever he is present. So I explained this to her, and I was very concerned that something had happened to the point where the cat was in fear of her life every time he was around. She starts to cry. She had suspected, and she asked me to take the cat and find it another home, which I did. The cat went to go live with a very rich woman, like 10,000 square foot house, and lived out her life with her. But she said that I can't protect the cat, and I need to focus on getting myself out of this relationship. So a very wise young woman, where it was just the behavior of the cat. This, I think, is a good lesson for all of us. This was the Good Samaritan case. This man was doing a home remodeling job at a residence, and he drives up in his pickup truck. And when he gets out next door, he hears this dog screaming. He goes over there. The garage door is open. He can see the dog's dragging her back legs. There's an adult female standing there, and he asked, what's going on? And she said, the dog is old. She needs to be euthanized, but I can't afford it. And he said, okay, well, I will pay for it if we go to my vet, if you want to. And she agreed, followed him to the vet with the dog. The dog looks at the vet. The vet looks at the dog and agrees the dog needs to be euthanized. Then she calls the investigating authorities because she found evidence that was suspicious, visible bruising, and older untreated injuries. And then I was called in to do the necropsy. This is some of the contusions, fresh contusions on the medial right hind leg, thigh, and groin area, pretty much an unkempt coat. And when I did the skin reflection over just the dorsal body and it went along the whole back, these are fresh impact blunt force traumas to the top of the dog. They were actually on the all over. They were on the sides of the chest. It was severe along the lower back to the point where there was hemorrhage into the abdominal spinal area tissues you could see. And that would have been the cause of the hind limb paralysis. There was an older untreated injury of the carpus. So they go to serve an arrest warrant to the woman for animal cruelty. And when they get there, they find the husband's home, and there is a young 7-year-old boy, and he has a black eye and bruises on his arms. So both parents were arrested for child abuse. And I love this case because it highlights the actions of why you should report when you suspect. The veterinarian that examined the dog originally did not know for sure what had happened. She just knew something was wrong, like this isn't right. The dog has got hind limb paralysis. Was it traumatic? She couldn't see the bruises, but she saw, or at least underneath the skin on the back, but she saw a dog that wasn't being cared for, contusion, untreated laceration on the carpus that was granulating. That was enough for her to say, hey, someone should look a little further. Maybe I'm right, maybe I'm wrong, right? And because of that, and this Good Samaritan, a child gets saved from abuse. So this is why we should always report. All right, give me one moment. I'm going to close this and open up the second. Oh, sorry. I've just learned when you have a lot of videos, things can tend to go wrong. Okay, so let's go to part 2. In the practice setting, as I mentioned, domestic violence as the cause is going to be the most common thing, the primary source of physical abuse that you see. They may bring their pet to you, they may be your client, or they may try to hide it from you by going to, not wanting you to know, by going to emergency hospitals, not realizing that most likely we're going to get those records sent over to us. The abuser may come with them or they may not, right? So you need to consider that as well. There was this case in Florida where a female client comes in with her dog for an injury. She's accompanied by her boyfriend, and then she manages to slip a note to one of the employees. Now, this practice has video cameras in their exam rooms and throughout their hospital. So her face has been whited out. You see, she's coming over here. She's handing the note. What she's done is gone to the bathroom. The exam room's up here, so keep an eye up here. She stops to make sure they're reading it. And he comes out right here. What are you doing? But that's a key thing, is the bathroom, it can be the one place that they can get isolated from them, right? So she manages to do that. And this is what the note said. Call the cops. My boyfriend is threatening me. He has a gun. Please don't let him know. So what would you do in the middle of your practice thinking that, right? That's what's happening right now. You got clients, you got drugs, you don't know what he's there with a gun for. Everybody's at risk, doors, protection. What is your response in the middle of always a very busy hospital day, right? So they call the police, and here's what happens. Now, what I want, police come in here, it was a great response. Watch right here when they lift up his shirt, there's his gun. And then we got police coming in the other door as well. They had it covered on both areas, right? Not what you're expecting when you go to, go to work every day. So here's what was going on. This was at DeLand Animal Hospital. He had been holding her captive for several days at gunpoint, beating her. Then he shot a gun to the dog's ear. So the dog had an injury from a gunshot. She eventually convinces him that we need to take the dog to the vet. So she actually uses that as a tool to try to get out and get some help. He continues in the ride in the car to threaten her at gunpoint, saying he's going to kill her entire family and if she does anything. And he is already a convicted felon. So he is charged with domestic violence, aggravated assault with a firearm, false imprisonment, simple battery, and then felons are not allowed to own firearms or have ammunition. So he was charged with that. He then called her 47 times from jail. And so stalking charges were added and they denied his bail. As of last time I checked, he was still awaiting, certainly the pandemic hasn't helped, he was still awaiting trial. Now, when you're taking a history in animals, potential animal abuse cases, it's a little different. You want to get more certain information. Remember, someone they know or close to them has abused the animal, right? Or them if it isn't them, right? So you can discuss the possibility. There's no hard and fast rules with this. This is just a skill of figuring out every gray zone, all the particulars of your particular case. So you want to avoid that. You can discuss it, that you're suspecting abuse, but don't be judgmental, don't accuse. They may be very reluctant to give details. I need more information to make the right diagnosis. I don't want to hurt your animal. I want to help the animal. So, and you want to document all the statements that are made and any witnesses. So if someone's in the room with you, you want to document what happened, what allegedly happened, where it happened, who was present, how was that animal kept, what was the husbandry, what was the environment, are they kept outside on a tether, are they on leash walks only, do they ever go outside, when establish timelines. When were the first signs? When did you first notice? What was the animal doing? What were they vocalizing? How, when did they stop eating? Any change of behavior? Asking that question, is the animal like everyone in the family? Does it prefer one over the others, or someone they seem to not like or be afraid of or avoid? Asking those questions. Is there any new people in the home? Any new relationships? Who has access to the pet? Is there workmen that have recently come working in the house? The housekeepers? Does the landlord, if they're renting, does the landlord have access to the home? Or do they have to give you notice before they come in? Were they recently there? Have there been any other animals that have had a change in the behavior? How's everybody else acting? Is anybody else been sick or had similar symptoms? You want to be gentle and kind and non-confrontational, non-judgmental. Like I said, make it about the animal. I'm very concerned about what's going on. I don't want to do things unnecessarily to the animal. I don't want to give the wrong drug. And sometimes changing the going back and forth and giving them time to assimilate it, but taking the focus off of them, making it focused about the animal. You often are doing these multiple discussions. You're going in and out, checking on them as you are uncovering different things about the animal. Consider, if finances are an issue, consider not charging or discounting for the radiographs. Get permission. Oftentimes you need those radiographs because you're also looking for older healing fractures, especially. So remove the barriers, find out what it is, but don't let them become a barrier that prevents you from figuring out what's going on and supporting them. You need to focus on, you have goals for that interaction, have a private area for them to wait, express concern for them and the animal, right? Having a staff member may be a good thing or it may be a bad thing, right? And it may be a male, female. You got to determine what are they most comfortable with, or are they being intimidated? Think about body language. There's all sorts of YouTube videos and books out about the kinesiology of interviewing or just body language in general. Get down on their level. Not towering over them sometimes helps. Identify and train staff members to handle certain aspects of the discussion. I was given this lecture one time in a state where they had just passed mandatory reporting. And I'm talking about this, and a veterinarian said, older male veterinarian said, I'm never going to be able to have those discussions. I just can't. He has a problem with being able to have these empathetic or at least generating empathy and safety discussion. So I told him, I was like, well, someone in your practice has got to be good with humans and train them, turn it over to them to have those discussions. Let them be that liaison and champion in your practice. Each situation is unique. You may or may not tell the client you suspect the abuse. You don't even have to tell them that you've made a report. As soon as I suspect I'm making a report, because I want to try to get that investigator there, if at all possible. If you think the abuser is present, try to separate them to have further discussion. So one of the things that I would do is say, I need to show you something, and it's in the back. I can't show it here on this computer or whatever, but we're only allowed to have one person, non-employee, back at a time. And that allows that separation. Whoever you're going to bring, whoever ends up coming, you've separated them, and then you can circle around and have that discussions. We've had technicians that would then go and say, we need to verify your credit card information. It's not coming, something to try to get the abuser out of the room. Now, if children are present, you certainly want to get them out, get a staff member to move them to an area. Now, if children are the abuser, it's critical that you report, because something has gone wrong. Something's wrong, right? Depending on the age of the child, there may or may not be an arrest. It's often an opportunity for intervention. There's going to be an investigation, home assessment. There may be court-ordered action, but you don't know if that home is already being monitored by Child Protective Services. You don't know if they have already a conviction or home. There's been call-outs for domestic violence there. You don't know, right? You don't know who's at risk. There was a case in Minnesota that veterinarian called me. Her client comes in, says, I want you to board all my dogs. My 19-year-old son is terrorizing the therapy dog for my autistic daughter. He just goes by the dog and he will just stomp on his feet. He's doing things, he's torturing the dog, terrorizing the dog, and I need to protect the dogs while I deal with him. And her question was, what do I do? I'm like, you report and you examine all those dogs, right? Examine them all for any hidden signs of abuse, but you report. That's a 19-year-old son. There's already, what is he going to do with a 19-year-old son? So you go ahead, get an investigator involved. There was another case in Maryland. Puppies brought in with a broken leg. Father and son come in. They go do the x-rays. The vet comes back to the room, tells them about the broken leg and asking about what happened. And the father said, well, my son just admitted that he broke the puppy's leg, but I will deal with it. And the vet's question to me was, should I have reported? Absolutely. Children are not doing animal cruelty in a vacuum, right? So this is something has happened, and you don't know if what he's going to do. How is he going to quote unquote handle it? So that, and we don't know if there's other animals at risk, there's other children. So you always report when it's a child. always, so that and they may need support of some kind. What if there's spousal abuse going on? All right, so report. Now, with suspected domestic violence and elder abuse, they have been isolated from their friends and family, and they're living in constant fear. This is both domestic violence victims and elder abuse victims, especially elder abuse. They're isolated and they're afraid of losing everything because they're depending on them for the care. They're not telling anyone that they're being abused. They're embarrassed. They're not telling their parents. They're not necessarily telling their best friend. So that's making them even more isolated, and they hide it well, right? The empathy and compassion that you express in the veterinary context setting may be the first, you may be the first person they've talked to, and it's the first empathy and compassion that they've heard. This is so important that in the UK, they have started doing training for veterinarians, offered training for veterinarians to have those words. What do you say? Because this is where veterinarians can really struggle. We know what to say when we've got a diabetic case or a cancer case. We know how to handle those interactions when we're recommending euthanasia, right? But when we've got cruelty cases or it's maybe associated with some kind of abuse of a human related to the animal, this is a new thing, right? Meet them where they're at, right? Don't force them to get to a place, just work with them. Your goal should be to protect the pet, number one, and provide resources for the owner, right? You are the advocate for the pet. They may be under the influence. This will happen. They may be doing drugs or be drunk or something. That's how they're coping with the situation. Don't be judgmental, right? So this is a video that we created with the Texas Veterinary Medical Association, trying to highlight what the interaction can be, just some suggested verbiage of what it can, what you can do when faced with a case of potential animal cruelty that's related to domestic violence. I need to get some more information so that I can help Cooper. You said that you live in an apartment and that your partner moved in with you about a year ago. Can you tell me more about what happened to Cooper?
Well, I was at work all day, so Cooper was home with my partner, and he said he slipped out, and then he must have gotten hit by a car, and he brought him in. But when I got home, I noticed that he needed to come into the vet.
Okay, does Cooper normally go outside?
He's an indoor cat, so no, he's not used to being outside.
Cooper's always really friendly here. He loves everybody. He's rubbing on everybody, purring and whatever. So I wanted to know, behaviorally, has he shown any behavior changes towards any specific people lately? Somebody he doesn't like or seems afraid of?
I think he's jealous of my partner because he's like, doesn't want to go near him. I think it's just, you know, he's not used to me getting affection from somewhere else because we were together once, and
yeah.
Now my partner's there and he doesn't like to be around me.
Well, I've examined Cooper, and his injuries are pretty severe, and they're not consistent with being hit by a car. They are consistent with blunt force trauma, though.
That's fine. I don't think I can talk to him.
Okay. Well, I see in his history that he's had several injuries. In this past year, he's been coming in for some injuries, and these are what we see with chronic and repeated physical abuse. And I'm really concerned about Cooper's welfare and safety, and I'm really concerned about yours as well.
Thank you.
Then this is even more critical. We need to get you some support and some information and resources, and I'm going to go through all of this for you. This is all local organizations and support systems for you and for Cooper.
Okay, I just don't want to leave him behind. If I do something, I need to be with him.
Yes, I agree. And in Cooper's welfare, but your welfare are both are both important. We're going to get through this together, okay? But I first want to talk, we're going to go over what we need to do for Cooper first, and then we're going to talk about you, okay?
Okay.
Okay. There are connections everywhere. Like I said, the studies go back decades on the link. It's been in psychological and social welfare fields, child welfare, animal welfare, adult protective services, law enforcement. These are all the different partners and issues that are being impacted by abuse and violence. So the issue is they're all working in silos typically, and they're not looking for animal abuse or animal abuse looking the other, for those connections. And they're also unaware. When I joined our domestic violence association here, they were not aware of the animal cruelty link to the degree that I expected, because the national hotline for domestic violence is headquartered in my city. So even that there's just a disconnect that we have to be aware of, and it needs to change because we got animals at risk. As I mentioned, it's being tracked by the FBI, but it's also been supported by our National Sheriff's Association, National Law Enforcement Association, that says to their deputies, their law enforcement, you need to make animal cruelty important to investigate. They're recognizing the advantage also, especially certain types of cruelty can be linked with drugs and gang members. And so it helps them, get bad people off the streets. It also can be used to get their search warrants, but they don't have connections to each other. Some places around the world, not a lot, but some have mandated this cross-reporting. So if you see child abuse and there's a pet, you need to report an animal to the animal services so they can conduct their investigation, and vice versa. But as veterinarians, we're on those front lines, and we can make that huge connection with bring them all together. We are protectors of animal health and well-being. We see animal abuse cases and indicators of family violence or family neglect, but we don't receive routine training on this, of recognition of animal abuse, or let alone human violence, human abuse. So we need to learn more, and we need to be part of a community response plan in our area. So what I want to talk about is, what does that response program look like, and what are resources for you? And this is a response plan for pets of domestic violence. So since we are the first in line to see animal abuse associated with domestic violence, we need to integrate into the animal cruelty into a coordinated community response, because not all groups are aware of this link or the delay statistics. Most of them are not aware of that 45 to 65% of those in domestic violence situations are delaying or not leaving because they don't have a place to take their pet. That's life-threatening, right, for the pet and the humans. So we need community-wide engagement, and we need to come up with strategies. So we need to start talking to each other, include the veterinary community in your area, the veterinary medical associations, both local and state, and animal cruelty investigation areas. Educate yourself and others. Identify what is the domestic violence programs in your area. What are the programs and what are the shelters? What do they have an animal program? Create relationships. Join those task forces. They could be local, or create, if you don't have one, create one, right? Have members of victim services, from the prosecutor's office, the law enforcement office. There's usually a state, regional, or larger task force, other interdisciplinary teams. And think about volunteering at a domestic violence shelter, which I have done. I had to go through training. It was eye-opening. eye-opening. It was 40 hours of training before I was allowed to volunteer, including a background check, right? So really, I encourage everyone to do that and become a resource for your area. What are the current processes? Do they have a pet plan? Do they have a program? Or some shelters, well, we kind of do it under the table. We let them bring in an animal, but we don't tell anybody. We're beyond that. We can do better than that. So if they have a program, what are those protocols? Do we need to modify that? And also on their intakes, a lot of them have phone calls, a hotline to come in, or it may be online for those that are needing assistance, call into this domestic violence hotline. Are they asking questions? Do you have any pets? How is that, because that's a risk factor. That should be considered a risk assessment as part of their risk assessment, right? And are the animals injured? Or are they okay? So ask for their input. We don't want to go in and tell them what to do, right? So ask for their input and discuss shared goals. This goal is to be proactive versus reactive, right? And it can feel like, especially in domestic violence shelters, that they're constantly under being reactive, but they're really good about having programs and getting ahead of that. But they rely heavily on volunteers. They're overwhelmed, they're under-resourced. We need to understand their world, why there may be all sorts of chaos going on. It took 3 months for me to get an email back. 3 months. Now I'm a veterinarian. I'm used to getting, and especially during a pandemic, but I'm expecting something back pretty quickly, certainly more faster than 3 months. So we've had multiple times where we had scheduled times to meet and they canceled. Right? Something comes up. One was a fire in the kitchen. So you don't know their world until you've been there. So be patient. Most of them, like I said, don't have a pet program, or have a limited space, right? So even if they do, they need more assistance. Now, those that have pets in domestic violence situations, most of them have had minimal to no vet care. And that means they also haven't had education about pet care. So this is a huge opportunity for support from our sponsors, like Purina, to be able to bring in those kind of resources, behaviorists to come in, or trainers to teach them basic things to work with children, especially. They need veterinary services day or night. They may flee in the middle of the night, animals injured. They may need temporary boarding. Oftentimes can we board them short term while they're getting out? We had one case here in Austin. They were visiting here during a music festival. The dog was with them. There was a domestic violence incident in the vehicle. Now what? They don't live here, right? So we were able to do a temporary placement while that she got help and he was incarcerated, and there you go. So care on site, providing care at their domestic violence shelter, and that opportunity to provide education. They need things like pet transport. If someone's injured going to the hospital, what are we going to do with the animal? Or the animal's injured and we need to take them to the domestic violence shelter. So pet transport services, certainly donations, and then funding for care of the animal. And how do we do that? What's that going to come from? We in Texas are looking at our foundation as to help with funding for care, to allow that kind of funding, or discount. The veterinary community can share the burden of looking at all these animals and rotate on a list, being able to offer services and do it for free. You may see one a year, right? yeah, hospitalization, work with a specialist. Can you get a surgeon on board? Whatever is needed. And then certainly there's grants, and we'll talk a little bit more about that. And there's also additional sources for funding. But that's part of the community response. The behavioral support for the animals. These animals are most likely going to be at PTSD, right? They've been living under chronic conditions of high stress, unpredictable stress, anxiety, physical assault, oftentimes. So they're going to need help. Chances are they're going to need some kind of medication with behavioral therapy to get them through things. They need a full vet exam, looking for signs of abuse. There may be additional charges that may help the person get out of that situation permanently if a person is charged. So we want to look for all those signs we talked about, do x-rays. And the impact on the survivor, this is anecdotal and talking with others and my own experiences, but when a domestic violence survivor, they may take the assault and they may even try to be protective of the children and still taking that assault. But when they find out oftentimes that their animal has been being abused and the degree it's being abused, that oftentimes seems to be one more tool in them having the resolve to stay away and to fight that way through a pathway to find a way to stay away from that abuser and a new life, a safe life. So that's just, like I said, anecdotal. Involve the local veterinary medical associations. There's often technician or veterinary nurses associations, hospital manager associations. Get them involved. 1 in 3 women, 1 in 4 men will have experienced this. Most people, it's either impacted them directly as a survivor or they know someone. Get them involved, right? Include specialty hospitals, animal welfare groups. Like I mentioned, the behaviorists, groomers. A lot of them need to be groomed. Think about that, mobile groomer. And there could be media, things. There can be something in it for them if that's needed, but most of the time, it's just that's your community support. Other additional boarding facilities, problem solve, meet and discuss. I was asked to do a needs assessment at our shelters, like what do we need? What are the issues? Because again, this is a blip on their radar and they're just getting through a lot of times, right, in the domestic violence situation. So we need to plan for these pets. We need a plan for co-housing, which is where the animal is in the residence with them. Or so co-housing, co-living, they're in the residence with them. That's the most ideal, right? Co-housing, they're somewhere on the property and they have to take care of them. So some places have built a facility, like a separate building, and that's where the animals are housed. But co-living is ideal, having that emotional support from their pet, right? Foster program is always going to be needed because they're always going to run out of space, right? Or there may be special types of animals, or they may have some behavior problems that they really doesn't work well in that shelter environment, and they need some special attention to transition them into a better space. So that's what we always need, right? And then they have, not everybody who calls a domestic violence hotline or is in need is coming to the shelter. They may be able to go stay with a friend, go to a hotel, whatever they're doing. They need assistance for their pets. So it may not be in residence survivors that need help. They've got to address, there's confidentiality issues for the survivor and the pets. We do not post on social media pictures of the pets. We do not use their names. So things that we might normally do in a veterinary setting or whatever, it completely switches, right? High risk of homicide, high risk of death when they leave for up to 2 years. Be aware of that. Be respectful of that. But we don't need to reinvent the wheel. Turns out there's tons of programs out there across the world and they have program templates, and they're willing to help, right? But it starts in your community, right? So the challenges, as I mentioned, crisis is their world. We don't understand their needs, and they don't understand the animal community. This can be completely foreign to them, right? They have concerns about confidentiality and violation of that. There's housing limitations, not only structural, but there may be regulations and space. And funding is always a challenge for them. The animal issues, allergies, they worry about allergies. Where are they going to keep the animal? What about the walk play areas? They need to have an area that's enclosed that a dog can run around and not get loose, and other children, you're protecting children that are running around. Don't design, I saw this, don't design a walk run path next to where the dogs are going to be. That's just, triggering for the animals. What if someone's afraid of animals? So some have buildings that are just set aside for those with pets, right, to help with that. There's things to do for allergies. But the type of animal, fish, reptiles, chinchillas, rabbits, snakes, right? What about the owner's education? There may not about the care and the medical needs. So behavioral issues. Transitional housing can be an issue when they're moving from the shelter, which is an emergency shelter situation, to transitional housing. What about pet deposits? What if they have breed or limitations of body weight, right? So a lot of times what shelters do, and is what they should do, is the pet is an emotional support animal, not a service animal necessarily, or a therapy animal, an emotional support animal. And at least in the United States, that falls under federal protection for housing. So they can't deny housing. Sometimes it can work that they don't have to pay a pet deposit, but they're allowed to have them as an emotional support animal. So all it takes is some kind of social worker, therapist, psychologist to declare that animal as an emotional support animal, and that helps them navigate around some of those limitations. And then, do they have the capacity for tackling this issue? We need volunteers, right? Again, they're not asking about pets on the hotline. The other thing I see is they don't have safety planning for pets on their website or on site. So that's important, that there's something there on their website about what do you need to do to leave with your pets. What's the microchip registered under? Getting the medication, the medical records, leashes, collars. They're also not necessarily doing a data tracking of a pet need. Right. So they may not even know what that need is because they aren't even tracking that. Some of them have expressed fear that if we advertise that we have a pet program, that they're going to be inundated by all the animal craziness. Right. So we need to work with them and reassure them on that, and approach this in controlled manners that are respectful. Right. There's also, I want to mention, there's this link to homelessness from domestic violence, in that once they get out of emergency shelter, or they may not go to emergency shelter, they may just become homeless. It's a significant risk factor. I want you to remember this. It takes an average of 7 times for those living in domestic violence, leaving 7 times before it's permanent, because there's so many problems and issues and barriers, finances, where do you live, resources. In Seattle, 76% reported barriers to resources because they have, due to having an animal in the system. Those that are homeless with a pet, 64% were harassed for having a pet, 55% said their animals were emotional support or service animals. So we need to keep that as part of our program, thinking about that. All right, so in the hospital, you want to create a reference binder with resources, information, documents of where to report animal abuse, contact local agencies, those contacts for the hotlines, get their brochures and cards. They will send them to them or give them to you for free. They have brochures that you can is your relationship, are you in an abusive relationship? That can be, they don't even realize they are. And identify what I call link liaisons within the practice, train them, train those staff, right? And then I've created a domestic violence pet exam checklist, so it makes sure you look for certain things, right? And I think that's available, will be available on WSAVA's website. It's certainly on my website, is that's free to download. All right, so you want to have that operating procedure. Increase your knowledge and awareness about domestic violence. And as I mentioned, the many barriers, the animals at risk if they're left behind. Put these brochures, posters, and cards in the bathroom. As I mentioned, that's the one place they can separate. At the front desk, I think in the UK, they had a barcode on like a tube of lip balm, and the barcode was the phone number. So it's something they could safely keep, that they wouldn't hide. They may slip something in there, but their abuser is often looking for things, right? And put safety planning, again, available from WSAVA on my website, safety planning for your pets. Put it on your website, right? Have that available. This is just going through some things that have happened from or things that are being done around the world. In Oklahoma, I thought this was excellent, and their safety planning, they ask about all these things for them, grabbing the vaccination records, telling them what to bring, don't post things or updates with the animal on social media. So that's all on their website. Now, where do you report? At least in the United States, the National Link Coalition has mapped the entire United States, county by county, and then color-coded the agencies based on what their responsibilities are. And you can click on your state, click on your county, and look at where you are to report, and it gives you the data. Now, this was a project that they use students for, but that's a tremendous, we can do this in the United States, so you can do this around the world. Where do you report? Create a website with those numbers, and then have that as a project for students to keep updating. Our Animal Welfare Institute did also a database of sheltering services that have plans for pets. They also have resources and funding sources. They developed 2 posters. You can order those even internationally or develop something similar. They put it up in veterinary hospitals for the staff too, because if you're not seeing it, thinking about it, you're not going to be looking for it. So it's like getting them to think that there might be seeing animal abuse, especially related to domestic violence. Red Rover is another, they work in the United States and Canada, and sometimes I believe beyond. They might partner with others, but they have a searchable site with shelter programs. They offer resources and grants for survivors that include that veterinary care and boarding. So they offer emergency grants for that, and also to help fund for even pet deposits. They have training webinars. They offer different types of trainings, and then they have brochures and flyers and stuff. Again, I like this 8 signs that may indicate an abusive relationship, right? Just getting them to think about that. Now, the Los Angeles SPCA developed this beautiful program called Animal Safety Net. It is absolutely a complete program that you can download. Go to their site to get. It includes forms. It includes PowerPoint slides for training for your fosters or volunteers. They have forms and for their veterinary exams, and if they told or if they're told on intake by the owner that the animal has been abused, it automatically triggers a cruelty investigation, right? So it's an amazing program. Madeline Bernstein, that is the president, CEO of their Los Angeles SPCA, is a former prosecutor from New York, and started the first animal cruelty unit, prosecutors unit in New York. So the forms are very well thought out legally, I will say. So I love this program. It's completely a foster network program through a shelter, driven through a shelter, but goes out to foster homes. All right. So that's one that's already done. Shelby Safety Net program. They partnered with the veterinary community. They provide statewide supplies to shelters. They are mandatory reporters in Alabama, so they do help support forensic veterinary exams. This is just different places. Now, the Lynx group is out of the UK. They have an amazing, long-standing program. They connect agencies together through, and they do support training. They also have this wonderful guide, Recognizing Abuse in Animals and Humans. If you go to their site, there's also a webinar on there I saw about handling things during the COVID. So highly recommend this guide. Now, this is the ultimate, to me, the best I've seen so far. The Link Toronto Safe Pet Program. This is now part of the Ontario Veterinary Medical Association Safe Pet Network. It's called Safe Pet. If you go to their website, this is driven by the Ontario Veterinary Medical Association, completely driven by them. So it's provincial. They maintain this database. I can't go into enough. It is absolutely amazing. And they have a full-time person now that started with it while she part-time and now full-time, connecting the entire province of domestic violence shelters, veterinarians, and pets, and safety places for them. Right. So if you go to their website, they have different webinars. I've got to do mine for them as well. And they have links to, if you want to assist, join up. It is, I was completely blown away and never seen anything like that. Our Texas Veterinary Medical Association is hoping to be able to start this as a pilot program for our state. It'll be the first one in the United States, but this is the way you do it. And they made some mistakes. They stopped it for a while and then figured out how to do it. And it's tremendous. These are some resources available online about co-housing or co-living shelters, a startup manual through Allie Phillips Safety Program. The Humane Society of the United States has a document you can download, a program about starting safe haven programs. A lot of the vet schools, the veterinary schools, colleges are starting to do this. And then I want to, I want to share this video. I will tell you it's triggering for me every time. I'm already going to tear up before I start it. It's important that we know what, or have an idea of what the domestic violence victims are going through and what it can take to get out. Okay.
I finally gave in to crying, and I said, God is not gonna let you beat me. He's not.
There are voices that find.
In the beginning, it wasn't complicated. It was very easy. The relationship wasn't stressful, and I believe that that's what attracted me to him.
Settle of dialect.
My elevation came very quickly. I was never ugly. I was never a horrible person, but I have been told that I attacked his ego because I told him that I would not purposely choose to have a child by him. And I went through a wall. I literally went through a wall.
We hear it.
My dog came over and began to smell me and lick on me. And that is when my abuser kicked him in his hips After my dog had been kicked, he kind of collapsed onto me.
In our defense.
And then he turned around and went after my abuser and then laid on top of me. My abuser came over and began to punch him. And when he did not get off of me, he grabbed my dog by his collar. We had a porch that you had to walk upstairs to get onto. And he threw him off of the porch. As I was coming around the corner, he drug him from our house a block to a very busy street and let him go in the middle of the street while cars were coming. And he said that if I reached for him or called for him, he would shoot him where he stood. I knew that I had to go.
Your dreams are beloved, your heart.
The police officer said, "I'm going to take you someplace safe tonight." Unfortunately, when a woman goes to a shelter, they do not take pets. I could not let that happen. This animal that just saved my life. Rose Brooks offered me the option to have my dog stay with me here at the shelter. I cherish Rose Brooks. When you're not ready to cry, they will make you laugh. When you can't sleep because it's scarier to be asleep than it is to be awake, they will stay up with you. And they cared about me when I didn't feel like I was worth caring about. I would not be sitting here if they would not have admitted me at 11:47 p.m. August 7th. I wouldn't be here.
So obviously that's a little older. It's 2012, but I think it's just the best story. In New York, they launched in 2013 a co-living domestic violence shelter. Purina was their sponsor, has continued to sponsor and work with them, and they built a play haven and dog park in New York City. And this is the Urban Resource Institute. And in 2019, I was able to join them. They announced they were opening 5 more dedicated shelters of co-living. And I don't know if you know this, but in New York City, there are so many regulations. There certainly isn't a lot of land, right? So it's concrete. But if they can navigate all that's needed in New York City to do that, I believe we can do this anywhere. Now, Purina also started a few years ago the Purple Leash Project, partnering with Red Rover. And this is an amazing program.
He was always threatening me that he was going to hurt my family in Mexico or my sisters. But then somebody contacted me and said that he was coming back and he was going to take the kids. So that's when I looked for the shelter. I wasn't expecting at all that I was not going to be able to bring Princess. And that was heartbreaking for the kids especially.
Do you mind reading the letter?
It says, Dear shelter workers, we know for some people dogs are just animals. But for us, our dog is family. She gave us joy.
The number of domestic violence shelters in the U.S. that accepts both victims and their pets is critically low, approximately 10%. Purina and Red Rover have teamed up to change that through the Purple Leash Project. We've committed over $500,000 to help more domestic violence facilities across the country become pet friendly.
Almost half of domestic violence victims with pets choose to stay in their abusive relationship rather than leave their pet behind. This is a choice no one should have to make.
At Purina, we truly believe that pets and people are better together. And that's why we've partnered with Red Rover to create the Purple Leash Project. We want to make sure that when a domestic violence victim leaves a bad situation, they don't have to leave a family member behind.
How do you feel knowing that you made a difference?
I feel proud. Just knowing that other families are going to keep their dogs or any pets, that's just awesome. Because for us, Princess was everything.
It's an amazing program there. And certainly Purina has been supporting us on an international level through WSAVA. We hope to be able to, again, do this program in 2020 to do a workshop. Or sorry, 22. I'm still stuck in 20 pandemic. So, all right. In summary, we want to engage the stakeholders, engage the local, regional, and state veterinary medical associations. When I brought this up on our animal welfare committee for the Texas Veterinary Medical Association, it was like a no-brainer. They're like, what? Wait, we want to do something. And it can take time. We've been talking about it for a couple of years. We have veterinarians from across the state. We're a huge state. But, once you explain it, they know that it's important to do. It's just how. And that's where we had the connections between the Los Angeles SPCA's program and a foundation, being able to work with the Ontario program and them sharing their template. It's going to be able to be done. What we did was also baby steps, and that's something to consider. Is the head of Dr. Katie Luke Broaddus from the Austin Humane Society became a volunteer over the domestic violence shelter to understand a little bit more, took that back to her shelter and working with their CEO. They now do a program similar to the Los Angeles one. So we've got that started here, right? I went and met with our hotline people. I asked them, could you start adding the pet thing on your risk assessment? So it's a grassroots kind of thing, but one person can make a difference. I'll just start connecting people together. Identify those funding resources and grants that are available. Establish those goals together and programs. When I went to our local veterinary medical association for Austin, they're like, oh, we want to do something. They wanted to fundraise, they wanted to do something. There's usually some kind of awareness campaign or something in each city about domestic violence. Well, the veterinarians should be there. We should be there to talk to them about their pets. We need to talk to them about safety planning for their pets. So being present there, I think, is important. As I mentioned, ideally rotating, putting your name in the hat in a list as your hospital is willing to take on. We have emergency practice that are willing. Hey, yeah, call them up. Can you take on a dog and a cat for an examination or hold them overnight? And rotating to share that burden. And of course, including other service providers. During the pandemic, as I mentioned, it has been very scary times indeed for the domestic violence on that aspect. So what happened is in Houston, in Texas, so south of me, they launched a free pet boarding program to help and they partnered with a local veterinary hospital. So just on their own, just decided to do it. So it can be done. We do need a community response for a community issue. It's critical that we are included as the veterinary community and all these discussions, and we can provide that education and to increase awareness and to increase voluntary cross reporting, right? If someone's aware, if a police officer is aware about the link with animal cruelty and he's there on a domestic violence case, call the animal cruelty officer, say, hey, we're gonna take a look, you need to come out. All right. There's, like I said, we're going to do a workshop. This is a One Health issue. We're going to do this workshop at our next WSAVA. That's the plan. And continue to not give up, break down barriers, be patient, form these connections. It's going to take everyone to make a difference. But it only takes one to start it. All right. And if something is unacceptable, we've got to do something. It's unacceptable for having a pet to be a barrier, and it's unacceptable for the pet to be left behind. So I challenge you, what can you do? Now, what can you do? I'm going to show you resources. One Health Certificate course is available. This is Dr. Lappin's baby, which is I was proud to be part of, but it's a certificate course on One Health. And I do have part of that is a lecture on domestic violence as a One Health issue. There are courses to learn more about forensics, veterinary forensics, and cruelty investigations. Online certificate course is available. Courses, 6 to 8 of them now on vetfolio.com. Spanish translation should be out. If not, email them or email me or contact them and say, when is it? It's supposed to have been done. There's a variety of species and topics. There's an equine only course and multiple instructors on there. So highly recommend that for you. Then American Animal Hospital Association came out with something called the forensic process. This is an Americanized version of the UK version of that is a fantastic interactive course about documentation, case file creation, forensics in general. It was created by a human forensics lab out of the UK. It is one of the best ones I've seen as far as trainings, and I'm a hard audience to please, so I highly recommend that. They will have a vet nurse one coming out soon. And I thought I had it in here. There is the forensic process UK version. So you can look up that online, and that should take you straight to their to that European one. The American Veterinary Medical Association offers now a Brave Space certificate for individuals and hospitals. It includes topics on domestic violence, workplace harassment, and diversity, equity, and inclusion. But it's a two-part module on domestic violence that has been highly, we've got great accolades from that. It's myself and Dr. Jen Brandt. Resources as far as books, mentioned Cruelty Investigations, the Veterinary Forensics Second Edition. It's an ebook. So there's that. There's also Pathology series that just came out, I think 2 years ago, 2-volume series from Springer Publishing. And then there was an entire issue of the Veterinary Pathology Journal devoted to that. So as you engage more on animal abuse cases, highly recommend getting more of those resources. And there's my contact information to feel free to contact me. And with that, I'm going to stop my share and we will open it up to questions.
Wow, Dr. Merck, fantastic as always. That was really great. And, we even have a surprise listener in the other room is Dr. McPhail, my bride, the surgeon. She's actually been listening and has been fascinated as well. So we've even got a surgeon attending today.
Oh,
unfortunately,
fantastic.
They're doing some construction right next now to me, and I'm having a drilling noise. So there we go. It stopped again.
No problem.
But we've had some interesting comments and questions. And it looks like we have a little bit more time. So I'm going to mute for.
Okay.
Okay, you stopped drilling. So Anna asked a question about, do you know if any of the vet schools are teaching students how to recognize signs of animal abuse to begin with, and then of course the link to domestic abuse. Do you know much about how many of the vet schools are doing that type of training in the United States or abroad?
Yeah. In the United States, it's I know it's growing all the time, right? So we have different courses being offered at Purdue, Georgia, Florida, Texas is doing as a mandatory rotation where they have to go at least through the animal cruelty shelter and do a training there. So a lot of times it's incorporated through shelter medicine. There's several vet schools that are the students have organized to do a safe haven program. You yourself have one out of Colorado State, Purdue, Texas, Georgia, Kansas. I think, I mean, and again, it's great for the students to do. They get an opportunity to do examinations, to do fostering. Now, I was just on the first International Virtual Forensics Conference, Congress, that was last week. And I don't know, I believe it was recorded. I don't know about the access. If you email me, or if you just look that up, International Virtual Veterinary Forensics. There was a man on there, I wasn't able to attend all 3 days, but he is teaching at Croatia, and it's mandatory for their students to learn pathology in Croatia. So I think it's growing. It's beyond, I was blown away there on that international side. I know that Mexico has organized a veterinary forensics association. So that's the other, is to look that up and see.
Great. Yeah, thank you for that. I think at least the states, I think all of us are attempting to have at least some contact. And if nothing else, Melinda or Dr. Merck was kind enough to record the WSAVA 2 hours. Hopefully this YouTube recording will be available as well. So if we can keep spreading the word, especially to our trainees, it's really a good thing that I think we all could do, especially those of us that have access to those academic trainees. Another more of a comment probably than a question, Melinda. Giramina had just mentioned that, you know, in some countries there are no public statistics about animal abuse, child abuse, and the relation to animal abuse, which again is probably just a lack of reporting, right? There's just no statistics for them to gather, you know, probably to help convince people that there's a problem. Do you have any hints for that?
Yeah, I mean, we need data, right? So if they are tracking the incidence of domestic violence, it's also going to be in that questionnaire, that data gathering. If they can just add a question, you know, looking at the different studies of, you know, was there a pet? Was the pet threatened, injured, or killed, or how? And that makes it part of that intake. A lot of that can be, you can even gather that at domestic violence shelters. Through theirs, to ask those questions. It's just a few more things to ask. But the data gathering is important. It really has, when you look at the different studies across the world, that are done, the numbers are very similar. It doesn't matter where you are, right? It doesn't matter where you are. It depends on what the pets situation, the number of pets that are owned in a different region of the world. But it's going to be, it seems to track similarly. And then, of course, we'd like the World Health Organization to add that, you know, data, if possible, to theirs as they are tracking other forms of violence.
Yeah, I think that's a great point. So there's continued recognition by things like organizations like WHO that will help a lot. It's got to be a problem though in countries that don't have that data from the human side of the One Health equation, and perhaps that's where our WSAVA One Health side of things can be beneficial. Actually, having the veterinarian driving the ship to try to increase recognition of this problem. So we sure do appreciate appreciated from the One Health Committee side, what you're doing for us today and with all your other previous works. And I know I'm thanking you from our main One Health sponsors, Zoetis, the Purina Institute, as well as MSD, as well as all the other great sponsors of WSAVA. But again, I think that's our whole goal, right, from the One Health side, is to make sure that any way that we can help humans by detecting problems in the pets first, actually drive it in those countries that may not have it. But it is kind of grassroots right now, right? We do some safe havening at CSU, but that's all that we currently are doing, other than making students aware of the problem. So another question that came up was about engaging the physicians. I know a lot of this comes from the recognition from the police as they investigate domestic violence calls. Is there a way that we can engage the physicians in our local community to somehow interact with us at the veterinary clinic on the same problem?
Yeah, I think that would be something from the domestic violence task force that has a direct, to the pediatricians, any kind of, a lot of times there's also an elder abuse, child abuse task force, so special victims task force, and I know like we work together with them so that then whatever their conduits are to disseminate information and updates about that, it could get to them, because I don't know that they have local associations or meetings, but to let them know, to make that awareness, is to maybe ask them. One place I think that we've really missed is school nurses. And teachers, because my mom was a school nurse and she would tell me about hearing things, and then didn't feel like she could report or say something. She didn't know what to do. She didn't want the child to be further injured. There's all those things they have to navigate, besides confidentiality, but also placing a child at risk further. But I think that we're missing it on that. And one thing you mentioned, the safe havens programs, I will call out that, like when talking with Texas, when they were doing theirs, they were all excited, but I'm like, are you doing a cruelty exam on all of them? Because that's what the students should be doing. And they hadn't even thought of that. They're just thinking, get the pet safe, get it into foster. I'm like, well, hold on. This is an opportunity, especially in a teaching hospital, but we need to be conducting a domestic violence or cruelty exam, looking for those hidden injuries.
Yeah, no, like I said, I keep learning from you. And so we'll continue to work on our curriculum at CSU as well. And then hopefully, like I said, the nursing, what a great way to recognize potential issues. And hopefully most of the med schools, at least in the US and hopefully around the world, would start considering this as a true One Health problem and considering it, from that side. Another quick one was a while ago, there was a kind of a position piece about whether or not veterinary insurance companies would actually honor non-accidental trauma in their policies. Do you know if anything ever came from that, or if the big ones like Trupanion, are they covering injuries to those animals that might have been induced by an owner?
That was induced by an owner. So I think, my understanding, I just saw that email come through, that I think it's going to be situational, but I believe, I was like, they should. And I guess if the policy's under the wife and the husband abused, it should be covered, right? Or is it the direct thing, right? I was like, it makes no sense for them. I mean, your medical insurance covers, if, so the insurance is for the pet, regardless of the cause, what if you, accidentally gave them the wrong medication, they end up in the hospital, they covered that. So I think they were starting to split hairs, but my understanding is that they would cover. It may try to, that was the craziest.
Yeah. Wow. You would hope that if it was a domestic abuse, animal abuse problem, that would still be covered, because certainly that one owner didn't want their animal being abused by that other person. So, well, maybe we can do a little research for that, and maybe it'll be a discussion for the workshop in 2022. So that's fantastic. Well, it looks like we're running a little bit low on time, as well as it looks like we've had most questions answered. If anybody wants to, in the next 30, 45 seconds, type anything in, that would be fantastic. But just like Melinda said many times, certainly would encourage all of us to be part of this grassroots, and if nothing else, being able to provide a haven for animals while the owners are being dealt with if we don't have places to house them. But certainly it's quite easy to do discounted fees. We had no trouble with our hospital director authorizing the programs here at CSU, and we actually donate it to the community. So thank you so much, Wanda. And let's see, looks like Emma's our organizer, who's hiding behind the video, has said that we've got lots and lots of thank yous, Melinda, but it looks like the questions are winded down. And so I think it's time to say thank you for wherever you are around the world to Dr. Merck for her efforts in this problem, and to share it with us at WSAVA via this webinar.
Thank you, everyone.